Well, speaking of surgery, it leads to my next question. You are both in the field of primary care. You've already Dr. Rich, you've already kind of given us some insights about why you prefer primary care to surgery.
Yeah.
Did you ever get a chance to do some of that as part of medical school?
Oh, surgery? Yeah, you have to do.
You have to do that as part of that, no matter what your specialty wants to be?
Yeah, no matter especially, and I do general surgery, orthopedics. I think I did a little ENT too. So a bunch of surgical rotations. I didn't enjoy any of them. It's blood, and it didn't work for me. And you're not talking to the patient, you're not getting immediate feedback. It's just, again, it's about connecting is what was most interesting to me. And so I think you have some of that, out of the OR, but I think a lot of your time is spent in the OR, and I enjoy that social interaction with the patients. It's rewarding for me. And so that's why I think it's a much better fit.
Dr. Wright, I assume in your rotations and so forth, you had to do some surgery as well. How did that impact you?
During my training, I did 6 months of surgery and 6 months actually of urology. But I really found surgery to be tedious. The hours were long. In those days, we would sit in surgery for 6 hours and just stand. And I thought, never, that's just not going to be me. I'm not going to stand for 6 hours. And it's just hard. I just didn't think it was my sort of thing. I just like Dr. Rich said, I think I prefer talking to people, getting to know them, and just putting together things, the story of their life, which is what a primary care physician does, in the sense that patients see lots of specialists, and then you're expected to put it all together to make it work.
Now, one of the things I want to talk about is what makes a good primary care doctor, in your opinion. Now, there was a Dr. Richard Belitsky, who was Deputy Dean of Education for Yale Medical School, who once told his freshman class, quote, "Becoming a great doctor begins not with what you know, but who you are. Being someone's doctor is about a relationship. That relationship is built on trust. Being a great doctor begins not with what you have to say, but your ability to listen." Would you agree with that statement?
Yeah, absolutely.
I think it's important to listen. I sort of pondered the question. I wouldn't want to describe myself. I think I would want my patients to describe me. And I think for me, being a good primary care physician would be a primary care physician that patients thought was a good primary care physician, rather than my opinion.
So you really have to be would you say you really have to be a people person if you want to be a good primary care doctor?
You have to have people skills.
Yeah, people skills.
Yeah, you have to have people skills to be able to do it, to be able to listen. You have to have patience, because again, it becomes like your family, and you love your family, but sometimes your family drives you nuts too. So you have to try to have that right balance with your patients, but you need to be accessible, and you need to be reliable, and you need to be there for them. And I'm sure he was much more articulate in describing that, but that's what you're there. You're there for the people, and that's, try to give them answers. And if you don't know the answers, you want to help them get to the right place where they can get the answers.
Now, some studies have shown recently that primary care doctors may be at higher risk for burnout. Would you agree with that? And how do you avoid the burnout?
I think the burden of being a primary care physician has increased over time, because I think there are less primary care physicians around as compared to the population. But I think if you enjoy doing it, that's one. Then you're actually working in a field that you enjoy. And so that does give you some sense of relief. But also you have to have outside interests as well. You have to have other things that you do. Being a primary care physician is great, but it's helpful to have time with family and to have other interests and hobbies that you pursue so that you can have a balanced life. And if you feel that you're getting burnt out, then it's time to take a break. Just a short vacation, a week is more than enough most times to sort of rejuvenate and come back ready to go.
Dr. Wright, you segued right into my next question, which is we're going to put aside the white lab coat for a moment and talk about the sort of life outside the exam room. Dr. Wright, can you tell me what Team Project T is?
Well, Team Project T was actually an elite dance group that was, my daughter, who's now in college, was a member of that group for about 7 years. And so as a dancer, we traveled all around the United States doing competitions. And because of, I was a dance mom on the weekends, and I got to see a lot of the United States, made great friends, did lots of things with other dance moms. And just for a moment, I wasn't a physician. I was just another dance mom watching my daughter perform on stage.
Now, Dr. Rich, your bio notes that you enjoy running, biking, spending time with family, and reading. So what book is currently on your nightstand?
Right now, I have American Prometheus, which is the book about the Oppenheimer and the Manhattan Project, which was a big movie, so I'm reading the book, which so far is much better than the movie, although I like the movie, but the book is very good. But yeah, that's what I'm reading right now, and I'd be running, except I sprained my ankle running, so that's on a little hiatus. But yeah, spending time with my family is probably number one.
So you like history? You're a World War II buff?
No, I'm actually not. So reading it is very good. I wouldn't say I'm a history buff of anything. I just kind of read things as they come. I'll usually maybe do a nonfiction, then a fiction, and go back and forth. And my kids love reading, so they'll recommend books to me to read. And I read much slower than them, but I do, read a little bit of everything.
And Dr. Wright, you find time in your schedule to act as the leading director of a children's Sunday school. Can you tell us about that?
Well, I used to be the leader of the children's Sunday school, and now I direct the teens church. As my children got older, I sort of gravitated to the older children. I enjoy doing it. I think it's important that children have someone or a group of adults that they can talk to and they can share their experiences. And I get to know what happens to them outside of church, what happens to them in school, with their friends. And I hope that I'm a safe person they can talk to about whatever they want to talk about. And I help them when they come to me, give them advice about life. And I hope that they will grow up to be useful and helpful citizens, and that they will do the same for their own children one day.
We'll take a break and be back with the next segment of Medoscopy.
Mercy Personal Physicians. Doctors conveniently located downtown and all around town. Mercy offers primary care, imaging, and easy access to top specialists, including our new lung cancer program, serving communities around the Beltway. Mercy Personal Physicians Overley, Mercy Personal Physicians Glen Burnie, Mercy Personal Physicians Reisterstown, Mercy Personal Physicians Lutherville, and our new location in Hunt Valley. With easy online scheduling, we make primary care personal.
Now, you both gone through a lot of different things in your life, traveled a lot, gone to different places, but somehow or another you both wound up here at Mercy, and you practice here. You've made the decision to practice here. Why? Why practice here versus some other hospital, some other state?
Well, when I started the practice with Mercy, it was all, I'm always like, well, let's try this and see how it goes. And then it's, turns out to be 16 years later, and like, I'm still here. Apparently we get along. I like to say our interests are aligned. We want to take care of people and take care of people in this community. I think the nice thing about Mercy being in downtown Baltimore is you kind of draw from the whole community of Baltimore. Even though there aren't that many people who live directly around Mercy, it still feels like a very community-oriented hospital. And I love being downtown. I like the energy of a downtown city. So I really enjoy the downtown community, and I love the patients that we bring in, and that, it's been great. I have no interest in changing it.
So Dr. Wright, why Mercy?
I think, one of the things that attracted me to Mercy was, I remember the first time I came here interviewing, they were doing daily prayers. And I like that. I like the fact that, one could be oneself. I didn't really want to be in an environment where I couldn't be who I was and I couldn't really practice my faith. So that was one of the main attractions. And at the time, Sandy Edwards, who was the vice president of medical affairs, he is from England. And so we had a lot in common and a lot of things to talk about. So I just naturally gravitated towards Mercy. And over the years, I like it. I actually love being downtown, just as Dr. Rich said. I think I've gotten to know a lot about Baltimore and to understand the culture of Baltimore. And I think that it's a wonderful place. And I do think that Mercy is a great place to work at. So I'm definitely happy to be here.
Well, Dr. Wright, Dr. Rich, I want to thank you both for joining us on the Medoscopy set today. Hopefully the viewers enjoyed the opportunity to get to know you a little bit better, maybe learn a thing or two they can apply to their daily lives. And thank you for watching. On behalf of myself, our guests, the Mercy staff, and the Sisters of Mercy, we wish you good health and humor. And until we gather again, may the road rise up to meet you. And you sat through the credits for our special Wait Doctor, I Forgot to Ask segment. This is where we briefly discuss the question each physician wishes their patient would ask but don't, or that hand on the doorknob question that patients may ask just as they're about to walk out. What do you think? What do you have for us?
I can go first. I don't know that as a patient, there is a question that I usually ask my patients to ask their specialists, or that I usually consider when patients are making decisions about their care. I always say to them, well, you should ask the specialist, what would you do if it was your sister or if it was your mother? And if I'm faced with a difficult decision as to, how to treat patients, I do try to think about that. Like, what would I do if this was my sister sitting in front of me, or if this was my mother? What decision would I make? Because then it helps to make decisions that perhaps are in the best patient's interest, particularly when there are more than one, options in terms of care.
So what would I ask the patient, or you want to what they
What
should
they-
ask
or
me?
Or what's that unreal question they asked you where they're, how it always is. The session is over, they're walking out the door. Oh yeah, by the way, I have blood in my stool. Should I be worried about that?
Yeah, they just say yes. Usually that's the question they should always start with.
Right.
I just wish, people would just come in and, tell us their problem, how they feel, and not what they think it is, but just how do you feel? And then let us interpret the data for them. I think it's great to get to know people. And I think you end up having that conversation, and then sometimes they just forget what they're going to ask you, and then they get the hand on the door. So, I just would love to have them ask that question right up front, because then I can think about it a lot more. Because once you're out of the room, you're kind of on to the next person. So.
That's the whole idea behind Wait Doctor, I Forgot to Ask, which was originally going to be a book concept. The idea of those questions that, because sometimes, particularly if you're seeing a specialist, you might have to wait, months to be seen.
Yep.
And then you're seen for 20 minutes, and then you're gone, and you're in your car and you're driving, like, oh, I can't believe I forgot to ask this question.
I would say write it down.
That's right, write it down.
Write it down.
Or
and
bring
it
someone
in.
with you.
Or bring someone, I do that, write it down, bring someone with you, and then life is good.
Thank you both.